In radiation oncology, sometimes some organs are not visible on the CT scan. So, today in the contouring session lecture, I will pick up on the organ that is called hippocampus. That is two on either side inside the brain, which is required for the short-term, long-term memory and as well as for navigation purpose. So we acquire a MRI image and we see all three sections: sagittal, coronal, and axial view. And then we see he start from most superior slice that will be at the level of tactile plate. You see the hypo T1 weightage MRI, that is hypo intense image you see at the level of a tactile plate. So how we uh, contour that you use this tactile plate area, the hypo intense area, and you see here the ambient cistern. And as you go inferiorly, you again see here the hypo intense area on a T1 weightage MRI. So you contour this thing, and then in a further slice, you see a very clear cut hypointense area at the medial side of the lateral horn of the and as you go up the this area is better seen on the MRI. So why it is important that because during the pediatric age tumor, if a low grade glioma, that we have to give uh, a dose which is bit higher on the tolerance dose of this hippocampus on either side. So what is the limit is set, that is 16 gray. If you go beyond the 16 gray, so your the memory function will be almost in 70% cases will be hampered. So in order to we avoid this area not to receive more than 16 gray. That's why we are contouring. So in a if suppose tumor is somewhere here, so that we save this area. That is the beauty of radiation oncology. So you see here quite clearly this hypointense area we are going to contour, and you see is the lateral horn and then medial horn, that is called ambient cistern, and in between two you see the hypointense area on a T1 weightage MRI. So you contour it. As you As you go up, you see this structure which I am contouring is getting anteriorly placed. And you see here is the area of a midbrain, at the level of a midbrain. So you see here is the ambient cistern, lateral cistern, this is a border of hippocampus. I'm going up. Now we are reached at the level of pons. It's somewhere here. This is a pons, this midbrain, this medulla. So can we plan the patient directly on MRI? Not. Basically, we do contouring on the MRI and then we get a CT scan, and both the images of a CT scan and MRI is after fusion. We can deliver the radiotherapy because the dose calculation cannot be done on the MRI. That we all know. The CT is the backbone for dose calculation. That's why we heard about the CT MRI fusion, CT PET fusion, but we never heard about the MRI PET fusion. The reason is simple. But the CT is the backbone for dose calculation. So as we gone up, you see here the area of hippocampus, the volume little more voluminous on the lower section of the slices, and here is the area of what that is amygdala, and this is the pituitary area. So at the level of a pituitary, we go up to the level of a pituitary, and you see here. And this is a stalk of a pituitary, that is infundibulum, and that's two characteristics horn of the pons. So you see the temporal horn of this ventricle, and on the medial side of it, you have to contour the hypointense area up to the level of pituitary. You see here characteristics of temporal horn of the lateral ventricle on the medial side of it. This and further medially there is a pons, and with along with the two characteristics horn. So how we check that, uh, are you contouring the right area or not? So you basically, now you see here there is no temporal horn list on this side, and this is a pituitary area. This is the lowermost slice, and then uppermost slice you go and you see here, and it coming down, down, down at the level of tactile plate. You see here this ends. So this is the basically hippocampus we contour. Or now on the software, how we check it, whether it is how much correct. So we see here how much percentage you have covered the organ. So you see here beautifully 93.11% volume is being covered. Almost 100% volume you have reached here. That's a software provided by the Prono system that you can counter check very this is a missing tissue actually. So sometimes the two different doctors delineation of a tumor or delineation of a critical organs like hippocampus we consider as a critical organ, because we cannot go a dose beyond the 16 gray. uh, so we can check this thing, the hippocampus, and with this uh, we end this organ. I like this one is missing here, one tissue area, but rest of the organ is being contoured nicely. So thank you very much, and we will be meeting in the second time with a different organ contouring.